Let's talk about a global pandemic. No, not that one. I'm talking about one that happened more than a century ago. This one circled the world in just 4 months, killed 50 million people worldwide, and 675,000 people in the United States alone. Now, if my math is correct, that's more than World Wars I and II, the Korean War, and the Vietnam War combined. I'm talking about the Spanish flu. Despite its name, researchers believe that the Spanish flu actually originated in the United States. One of the first recorded cases was in March of 1918 in Fort Riley, Kansas. By the end of that week, 522 men had been admitted to hospital with similar symptoms, all before anyone knew what it was that they were dealing with. While this new severe influenza had seemed to spread like wildfire, it mostly remained within the ranks of the military, and because of this, it was widely overshadowed by Prohibition and the beginnings of what we now call World War I. By May of 1918, the Spanish flu seemed to have run its course through the United States, but by that time, American soldiers who were carriers had joined the Allied forces in France, essentially spreading the disease to ally and enemy alike. What made this influenza especially baffling to healthcare workers was that it attacked healthy, strong adults more often. Normally, flu is only life-threatening to the elderly, young children, and people with compromised immune systems. Many adults become sick, but very few die. Spanish flu turned the tables on this pattern. The virus attacked everyone similarly. It started like any other influenza case, with a sore throat, chills, and fever. Then came the deadly twist. The virus ravaged its victims' lungs. Sometimes within hours, patients succumbed to complete respiratory failure. Autopsies showed hard, red lungs drenched in fluid. A microscopic look at diseased lung tissue revealed lungs so full of fluid that victims literally drowned. The slow suffocation began when patients presented with a unique symptom: mahogany spots over their cheekbones. Within hours, these patients turned a bluish-black hue, indicating lack of oxygen. When triaging scores of new patients, nurses often looked at the patient's feet first. Those with black feet were considered beyond help and were carted off to die. While all eyes were focused upon the great battles being waged in northern France in the fall of 1918, local headlines of the battles across the sea were on the front pages of newspapers, while smaller articles listed Nebraska's combat casualties. The disease, said to have been sweeping through Europe, had now broken out in the greater Boston region and was spreading rapidly. It affected the entire nation, and Buffalo County, Nebraska, did not escape its reach. At the time, thousands of area residents were attending the county fair in September when Spanish influenza first appeared in national news columns of the Kearney Hub. Local authorities didn't feel threatened even as hundreds of deaths were being reported. At the height of the disease, 175 people a day were dying in Boston, 600 to 700 people were dying in New York City, and the incredible figure of 1,700 people in Philadelphia. There is no evidence in the newspapers of the panic the Spanish flu was causing elsewhere in Buffalo County, as people were more concerned with the fire that destroyed the Kearney canning factory than this faceless killer. However, by October 1st, at least 20 cases were reported in Kearney, and there were 4 known deaths in Nebraska. A week later, the physicians in Kearney admitted there were quite a number of cases in the city, but they said there was no need for a quarantine, the closure of schools, theaters, or churches, as was being done in larger cities. By October 7th, Ravenna had 60 to 75 cases and was the first city in Buffalo County to impose a quarantine. Businesses and other places that people gathered were closed by 7 p.m., and there was an 8 p.m. curfew for children. These actions turned out to be justified because 12 days later, a total of 6 people had died from this flu. On the 14th, Kearney had reported only 2 deaths, and the Kearney Hub advised shoppers that the area was still safe enough to gather. But by the next day, the State Board of Health announced that the entire state was to be placed under quarantine. Within 24 hours, 27 new cases had developed. The town of Shelton, however, had no reports of illness, and by October 17th, Shelton had not placed a ban on public gatherings. That is until only 2 days later, on October 19th, when they had approximately 30 to 45 cases and 3 deaths in or around the town. There was no mention of the illness in Shelton paper until October 24th, where it was stated that all public places were to be closed because a strange disease was affecting many in town. By that time, there were more than 20,000 cases reported in the state. It was established that all papers should carry information on the nature of the disease and how to avoid contracting it that was provided by state and national agencies. Everyone was told to avoid crowds, people with colds, and the use of roller towels or common drinking cups. They were advised to cover up coughs and sneezes and not to spit on floors or sidewalks. Does any of this sound familiar? Unfortunately, there were no known ways to treat influenza. Victims were told to keep warm, go to bed, and call the doctor. Several doctors around the nation reported finding cures, but the sad fact is that had an effective vaccine been developed, it couldn't have been produced and distributed quickly enough to have had an effect on the course of the epidemic. Pharmaceutical companies worked around the clock to come up with a vaccine to fight the Spanish flu, but they were too late. The virus dispersed before they could even isolate it. With no vaccine to protect against influenza and no antibiotics to treat secondary bacterial infections, control efforts worldwide were limited to non-pharmaceutical interventions such as isolation, quarantine, good personal hygiene, the use of disinfectants, and limitations of public gatherings, which were applied unevenly. While some accepted the changes, others protested regulations they'd considered unfair. Some called for more stringent methods, while others blatantly broke the rules that were intended to protect them. In St. Paul, all influenza cases were supposed to be reported to a physician, who in turn was required to isolate the case in his or her own home and notify the health department. Several problems sprung up with these requirements. For one, both physicians and patients were often hesitant to bring attention to cases. The ill also sought to evade isolation in their own homes by not seeking medical attention or only seeking medical attention when they became gravely ill. Looking back at the 1918 pandemic flu, we see many similarities to the COVID-19 pandemic a century later. Photos from gatherings in 1918 showed masked crowds, streetcar operators arguing with unmasked riders, and hospital wards overflowing with patients. Vaccination mandates of today actually have a precedent in George Washington's 1777 smallpox vaccine mandate for the Continental Army. And now we apply the mistakes and lessons of our past to improve our future.